My name's Diana Lopez, and I am a member of the Marin County Commission on Aging. Member of the Marin County Commission on Aging and co-chair of Age-Friendly San Rafael Community Partnership, and also a HICAP counselor. And HICAP is the Health Insurance Counseling and Advocacy program, and we help folks with everything related to Medicare. And the clever title for today's presentation came actually as it was something that we had done in the past, and then we added going online, because we're not only waiting on hold on the phone, but sometimes we have to wait a long time online. So welcome. And I was going to ask Patty Stolier to tell us about next month's forum.
Thanks, Diana. Next month is something every single person needs to think about, and that is what happens after we're dead. My sister bugged me for years saying, do you have a plot? Do you know what you want to do? And so this is going to be led by someone who hosts death cafes. His name is Jim Van Buskirk, and very, very familiar with all the options for living memorials, cremation, human composting, cemetery burials, everything, and also the very difficult conversations, how to initiate those with your peeps so that they know what you want. So you may not need this information this week, but you may need it in 10, 20 years. So please tune in on November 16th, again at 10:30, and find information on Dying to Know, Navigating Mortality. Thanks, Dan.
Thank you, Patty. I'm going to talk a little bit about Medicare itself, and then I'm going to talk about the changes the changes in Medicare for 2023. As we all know, Medicare is national health insurance, covers pre-existing conditions, and your eligibility isn't determined by your income. Part A covers hospital services, and Part B covers outpatient services. And important to know that Medicare really cannot go broke. Part A is funded by payroll taxes. Part B is funded by premiums, federal and state revenue, and interest on its investments. There have been times when there haven't been enough funds to cover all the expenditures, but Congress has always come through and covered all the expenditures for Medicare. So when people worry about that, for the moment, it's one less thing to worry about. It's a huge system. It influences the entire healthcare system. In California, it covers 6.2 million people, 700,000 of whom are under 65 years old. And it covers people of all ages who have end-stage renal disease and ALS, or have been disabled for 24 months. If you're disabled for 24 months, on the 25th month, you automatically become eligible for Medicare. It's a little bit different than when you turn 65 and you have this initial enrollment period, but HICAP counselors like myself can help people navigate through that process. This year, based on some of the provisions of the Inflation Reduction Act, there are a number of important changes to Medicare. The monthly cost of insulin will be capped at $35 for every Medicare beneficiary. And the IRA also expanded access to free vaccines for adults. Drug companies are their feet are going to be held to the fire, because they're going to be subject to financial penalties for raising prices more than the general rate of the consumer price index. And then moving into 2025 and 2026, there will be a $2,000 out-of-pocket limit for Part D prescription costs. And Medicare finally will have the right to negotiate lower prices in the same way that the Veterans Administration has had for years. And that is going to have a significant impact on the cost of medication for people who receive Medicare.
Excuse me, Diana, I meant to ask you at the beginning, when someone has questions, would you like them to raise them after a certain portion? What is your plan for pausing?
So there are some natural breaks in the presentation. So rather than holding them all to the end, I was going to intersperse them.
Great.
What is that an all right process?
That's terrific. I've just let people know if they have a question that comes up, put it in the chat so it's remembered and they can continue to listen to what your new information.
Absolutely, and because I have the presentation up on my screen, I can't see the questions in the chat. So
I'll bring them up to you when you pause.
Thank you very much.
Sorry to do that.
No, that's all right, no problem. The Bennis Act, finally, this has been in the works for quite a while, and beginning at the beginning of 2023 in January, it will eliminate the wait. Say let me give you an example. If you signed up for Medicare Part B and it wasn't during open enrollment, it wasn't during a regular enrollment period, there was a 7-month wait for coverage to begin. And now that provision has gone away, so that people who are enrolling in Medicare Part B don't have to wait 7 months beginning in 2023. They will be eligible for coverage through Medicare Part B the first day of the following month. And this is a huge deal because many people went without coverage for that 7-month period. And as I mentioned earlier, this has been in the works for a while and has finally happened. So are there any questions so far?
Not in the chat. Somebody want to come off mute and ask a question?
Okay.
Okay.
So as most of us know, there are 2 ways to get your Medicare. Original Medicare, Medicare Part A, Part B, Part D prescription plans, and then a Medicare supplemental or Medigap plan. The second way to get your Medicare coverage is through a Medicare Advantage plan, which are health maintenance organization and preferred provider organization models, 2 different models. Combines Medicare Part A and Part B, and typically Part B. Also, all the benefits of a Medicare supplemental plan, and so you don't need nor can you purchase a supplemental plan if you choose to go with a Medicare Advantage plan. Today's presentation is going to focus on Medicare Part D and also on Medicare Advantage plans and the changes in those for 2023. That's why they're in red in these slides. Original Medicare, the piece of Original Medicare, the Medicare Supplemental Insurance Policy, is a separate insurance product. And the enrollment period for that particular piece of Original Medicare is different. It is the day of your birthday and 60 days thereafter. So I just want to make that clear, and also that I'm not going to be discussing that this morning. So this is the big news for this year. There is going to be a significant cost of living increase for 2023. 8.7%. It's the highest cost of living adjustment, COLA, since 1981, which is going to be significant for many, many people. The Social Security Administration bases the COLA on the inflation rate during the 3rd quarter of this year, September 2022, and it was 8.2. So they've actually they use that as their mark how much they're going to increase the cost of living. And the average monthly benefit for someone who has Social Security will be more than $140, with a typical payment going from $1,681 to $1,827, which will make an enormous difference for a lot of people who have Medicare. So here's what most people want to know. How are the costs for Medicare changing for 2023? The Medicare Part A costs are going up. The monthly premium, if for Part A, the highest monthly premium for someone that has to pay a monthly premium for Medicare Part A, and remember that people, those of us who have worked 40 quarters or 10 years, do not have a premium for Medicare Part A, but other folks who haven't worked that much or worked in the home or had some other kind of situation do have to pay a monthly premium. And then the deductible has gone up about $40 to $1,600 per benefit period. Daily copays went up to $400 starting the 61st day if you're in the hospital 60 days, and skilled nursing went up slightly to $200 a day starting on the 21st day if you happen to be in a skilled nursing facility. All those costs are going up for 2023. Medicare Part B costs have gone down. The monthly premium for 2022 was $170.90, and for 2023 it's going down slightly to $164.90. And the deductible, I'm sorry, I can't remember, I think it was $234. That also has gone down slightly. Co-insurance stayed the same and typically does stay the same. It's about 20% of the cost. So I guess a bit of a mixed bag, some good news and some not so good news. And as always, I always want to remind everyone that there are additional costs with Medicare. So if someone who has original Medicare chooses not to purchase a supplemental plan, then they have a 20% cost sharing, which can become significant. There are some out-of-pocket costs, and as we all know, there are a number of services that are not covered: vision, dental, hearing, and definitely not long-term care. There is an enormous movement afoot to have Medicare covered dental care. I don't know when or if that will happen, but the understanding and realization that dental care is just basic to healthcare is really taking hold, and I'm hopeful that we're going to see some movement in that area. Vision care doesn't mean that you can't go get your eyes checked or you can't see an ophthalmologist. It really means that glasses, contact lenses, and things like that are not covered by Medicare. And long-term care is an issue that has been on the table for a very long time. Long-term care policies, people who have become so expensive that some people have just let them go. And we all know that there are costs to growing older, healthcare costs to growing older often that are covered by Medicare, and that people need to pay for out of pocket. And long-term care insurance would really be a way to mitigate those costs. There is a lot of work being done in Sacramento, but we're really not there yet. But I bring them up because they're really critical. So Medicare Advantage plans. As I mentioned earlier in the presentation, there's original Medicare, and then there are Medicare Advantage plans, HMOs or PPOs. In 2022, 3 million Californians were enrolled in Medicare Advantage plans. The ones that we know best here in Marin are Kaiser and United Healthcare, but there are a number of others, and I'm going to discuss those a little bit further in the presentation. And because the way Medicare Advantage plans are organized, they are able to offer a wider range of supplemental benefits, including vision, hearing aids, dental, fitness benefits, some breaks on over-the-counter medications, and worldwide urgent and emergent care. So the Medicare Advantage plans are growing, and the proportion of people, the percentage of people that are covered by Medicare Advantage plans is growing. And one of the important focuses of Medicare Advantage plans is that the focus on needs for people that have chronic conditions. A number of years ago, it was realized that folks with chronic conditions need more than just doctor's office visits. They need some planning, they need some they need to be able to get to appointments. Sometimes they need food, and they need other kinds of concentrated attention so that they can maintain their health in the best way possible. So this area is of Medicare Advantage plans continues to grow. Oh, sorry, this is a double slide. I beg your pardon. I'm just going the wrong direction. I beg your pardon. Okay, so I have 3 slides of these. These are the Marin County Medicare Advantage plans for 2023. And I'm not going to go through all of them, but I just wanted to show you, for instance, with Aetna Medical, they have a number of different plans. They have HMO plans and PPO plans, and all of their plans, or most of their plans, have a $0 premium. Aetna is new to the market in Marin County. And so don't be usually the $0 premiums are kind of a loss leader. Companies offer them in order to get a share of the market. So be very careful if you have an established plan and you're thinking about changing. Really pay attention to what the 0 premium means. But what I wanted to show you is how many different plans, for example, that Aetna Medical has. And they all have a little bit of a different twist on them. PPO is a plan where you have a little bit more latitude in terms of going outside the plan network. And the HMOs really are in-network plans. The one at the bottom, the Preferred Medi-Cal HMO C-SNP, has a premium and an RX deductible. And this is an example of one of the plans that's specific to individuals who have Medi-Cal. And you'll see later on, I'll show you actually on the bottom of this page, a little bit further down, that there are some of these plans that are special needs plans that are specific for other kinds of issues. For example, Align Senior Health has a special needs plan for people with dementia, and also one for folks with end-stage renal disease. So we're beginning to see a real change in the landscape of Medicare Advantage plans by tailoring their plans to specific chronic illnesses or specific populations, like folks who are eligible for Medi-Cal.
Diana, I'd like to cover one question since it relates. How do PPOs work with Medicare? Patty, did you get the sense of your question answered already, or do you want to know more?
More, please.
So Medicare, Medicare works with PPOs in this way. They have their own network. And so if you sign up for a preferred provider organization and you stay within that network of physicians, you pay a certain amount. If you decide that you wanted to go to a physician, a surgeon, or I'm trying to think, a surgeon is a good endocrinologist outside the network, then you would pay more. So they do allow the PPO. One of the features of a PPO is that you can stay in network or go out of network. And in an HMO, you typically cannot do that.
Thank you.
You're welcome. So here we have another group of plans that are going to be available in Marin County in 2023, Alignment Health Plan, and it has a special plan for veterans. The issue with the Alignment Health Plan is that it is a Brown and Tolan plan and really based in San Francisco. So it's hard for people to find physicians, especially primary care physicians here in Marin. But if there is some specific reason that this plan would work for an individual, it's available here in Marin. Humana this year is just new in Marin and just offering one plan, Humana Gold Plus. And then you see, and I've not seen this before, where Imperial Health Plan is also new in Marin County. And they have these interesting titles to their plans: the Courage Plan, the Dynamic Plan, the Strong Plan, the Traditional Plan. And I know a bit about them, but this is something that we're beginning to see. So I think what it was maybe 2 or 3 years ago, we had 3 or 4 Medicare Advantage plans that were being offered in Marin County. And this year we have 27. So you can see how they're growing. And then this is the last slide. This is Kaiser. Kaiser Basic HMO, and the Basic HMO would be a catastrophic plan. Even though the premium is 0, the coverage is not very deep. Copays are high, maximum out of pocket is high. The traditional Kaiser plan is the enhanced HMO. The premium this year has gone down and to $70 a month. And then Kaiser, as they have had for a long time, a special plan for folks that also have Medi-Cal. United Healthcare has expanded their options in Marin County, and they've been a player in Marin County for quite a while, and they have some strong plans. And then Western Health Advantage just came into the market last year. So these are the Medicare Advantage plans for Marin County for 2023. Are there any questions at this point? Okay. So as beginning 2022, people with end-stage renal disease can join Medicare Advantage plans. Before that, if someone had ESRD, they could not join a Medicare Advantage plan. They had to stay with original Medicare. And the premiums for Advantage plans have been declining for several years, and this year will again be lower than 2022 and the lowest since 2007. Medicare Advantage plans, as we all know, because we've lived through and are living through the COVID pandemic, extended their telehealth services and coverage to help people manage chronic conditions. And one of the downsides to Medicare Advantage plans is that the out-of-pocket maximum has increased to $8,300. Not all the plans have that limit, but unlike original Medicare, which doesn't have any out-of-pocket limit, and if you have original Medicare, it's one of the reasons that you want to have a Medicare supplemental or Medigap plan, because there's no limit to the out-of-pocket. Medicare Advantage plans have a limit to out-of-pocket expenses, which means that if anything that you spend, your copays for your prescriptions, your copays for your visits, your copays for outpatient surgery, if they come up to a certain limit, I was trying to remember what Kaiser's was $4,900 last year. So if you reach that $4,900, after that, you pay nothing. So it's one of the things to definitely consider if you are trying to decide between original Medicare and a Medicare Advantage plan. Okay, now we're moving on to a piece of original Medicare, Medicare Part D prescription drug plans. This year, there are 26 plans, and the monthly premiums vary significantly. The lowest plan premium is $4.50, and the highest one will be $172.50. And people say, well, why wouldn't I just go and sign up for the $4.50 plan? Will be in that plan if you have medications that are, say, in the higher tiers, cancer medications, some cancer medications, some other medications that are quite expensive, you will pay more for them. So someone in those circumstances, signing up for a more expensive drug plan may be exactly the right thing for them to do. The deductible went up. The top amount for the deductible will go up to $505 in 2023. And the formularies, so whatever plan you choose, you have to ascertain if the medications that you are taking are in their formulary. And I'm going to tell you how HICAP can help you with all that. And copays and coinsurance vary by plan and by tier. So generic medications will be in tier 1 and tier 2, and then medications that are under patent will be in the higher tiers, and then medications that are wildly expensive will be even in the higher tiers. And one of the key things when you're deciding about your prescription drug plan is to note that there are preferred pharmacies. Each one of these prescription plans contracts with a pharmacy. So let me give you an example. Say you have been picking up your prescriptions at CVS, and CVS doesn't contract as a preferred pharmacy with your prescription drug plan. The cost of your copays can be significantly different. So it's one of the things we do at HICAP when we do a prescription drug search, is we make sure that you know which ones of the pharmacies are the preferred pharmacies. And sometimes, which really surprised me, and I want to share this with you, is that I always thought that mail order would be less expensive. And in fact, it isn't necessarily so. So that's another thing that you have to check for. If you are getting your prescriptions in the mail, make sure that you're getting the best price. Which Part D is right for you? It really depends on the medications that you need. Each medication has a different price in each prescription plan, and each plan has a different formulary, and the formularies shift, and they can actually even shift during the year. And in my mind, that should not be, that's sort of changing things up in the middle of the year is not a good idea, but prescription plans can do that. And each plan negotiates a different copay with each pharmacy. So this is critical. That's critical for each of you who have original Medicare and a Part D plan to really look at the cost of your prescription plan and the individual prescriptions every year. Sarah.
Thank you. There are two questions. And maybe you'll cover this one later. Is telehealth going to continue beyond the pandemic years?
Yes.
Okay. And what about good prescription RX cards for prescriptions?
And I'm going to talk about that a little bit more, a little bit later. But yes, good RX is a really good place to look. So ways to lower your prescription costs. Do an annual search of Medicare Part D plans. If you can, switch to generic prescriptions. And sometimes, as I mentioned a little bit earlier, mail order pharmacies can sometimes save you money, but not always, so be careful. RX discounts like GoodRx, online discount programs are also available, but make sure they're legitimate. There are some out there that promise things that they don't deliver. And if you have a medication that is very expensive, Every pharmaceutical company has assistance programs. You can apply for those programs, and very often the pharmaceutical companies will provide the medication for free. Veterans Administration, many people have both veterans benefits and Medicare, and you can have both. Some people choose to just use their veterans benefits. Some people just choose to use Medicare. Other people use a combination. But one of the things that we advise our clients is that if you have veterans benefits, to use their TRICARE prescription benefits. They've been able to negotiate for years, and you can get usually a better deal. So that's something that you want to consider. And if you have retiree health benefits, make sure that you know what your retiree benefits cover. And if they cover prescriptions, make sure you can compare the cost of the plan and the copays with a traditional Medicare Part D plan, because you might be able to save some money that way. And then folks who qualify for Medi-Cal, Medi-Cal does not, well, it does actually pay for some prescriptions, but once you become eligible for Medicare, most prescriptions are not covered by Medi-Cal. So Medi-Cal will automatically send your information to the Social Security Administration to see if you are eligible for the extra help program that provides medications at a very, very low cost. So make sure that you take a look at these strategies to lower your prescription costs. And there are a lot of them, and HICAP can help with that. To do a Medicare Plan D search, right now it's open enrollment, October 15th through December 7th, and we are busy doing a lot of Medicare Part D plan searches. If you are comfortable with it, go on to Medicare.gov and you can do your own Medicare Part D plan search. You can view your what the cost would be if you stayed in your current plan for 2023, and actually from the Medicare.gov website, you can go right ahead and enroll in a different Part D plan if you think that it would be a better plan for you in 2023. And just a note, you don't need to disenroll in your current plan. When you enroll in a new plan, you will automatically be disenrolled in your current plan for 2023. And if you would like us to help you, HICAP will complete a free search for you. Just go to the Senior Advocacy Services North Bay website. The web address is here. And you can, if you don't have a computer, you can print out the form and just mail it to HICAP, and we will get it and we will perform the search for you. And we will, if you have a computer, we'll send you back the comparison of the 3 least expensive Medicare Part D plans for 2023 with some nuances, because if you want your current plan to be in that comparison, we will do that too. You'll receive customized results that reflect mostly the least 3 expensive RX plans for 2023, and we're right in the thick of doing this right now. So please let us know if this is something that we can help you with. Low income assistance. I just mentioned a couple slides ago, extra help. It's administered by the Social Security Administration, and these are the asset limits which have changed for 2023 and have gone up. So your monthly income needs to be below 150% of the federal poverty level, and your assets for an individual less than $15,510. And you can apply online, or you can apply on the phone, or we can help you with your application at HICAP. If you, I don't know how many of you have been on the phone with Social Security lately, but they will actually make an appointment for you, and they're very good at within a 5-minute time range of calling you and keeping that appointment. Some people really prefer to do this work over the phone, and that's available to you too. And I think I'm coming up to my last slide. Oh, not quite the last slide, but I just want to let you know what we do at HICAP. We do counseling and we do education for people who have or about to have Medi-Cal. And we proudly tell everyone that HICAP started in California. We're administered by the Older Americans, funded by the Older Americans Act, and administered by the Federal Administration for Community Living, and we're managed by the California Department of Aging. All of us who are counselors are certified to do this work by the state of California, and we have extensive training and also moderate continuing education requirement in order to maintain our certification. We are, many of us, most of us actually, volunteers. There is a small paid staff. The office is up in Petaluma. And these are the areas that we can help you with. Your Medicare benefits and rights, and we can help you if you need to appeal something through Medicare. The supplemental plans, retiree plans, Veterans Administration health plans, Medicare Advantage plans, which I've been talking about this morning, Medicare Part D, low-income assistance programs, and we have a few people who are able to help and well-versed in long-term care insurance if that's something that you need assistance with. So we try to cover as many bases as we can and provide as extensive support and services as possible. And this is our contact information, and I'm going to go here because, and I will provide this a copy of the slideshow so that it can be sent out to the participants. And I also want to put my name and information in the chat. And Sarah, if we have any questions while I'm doing this, I can probably answer them.
Patty, was your question answered about extra help?
No, I wanted to know if qualifying for extra help and qualifying for Medi-Cal were the same process.
So okay, so if you apply for Medi-Cal and if you apply for Medi-Cal and you have Medicare, Medi-Cal will automatically send your information to the Social Security Administration, and they will do the determination about your eligibility for extra help.
So there's no Medi-Cal with Medicare.
That's right.
It's extra help.
Yeah. Once you become eligible, sorry, I can't walk and chew gum at the same time. Here we go. So once you become eligible for Medicare, Medi-Cal no longer pays for prescriptions. There are exceptions, but in the main, that's the way it works.
Well, I have a family member that had Medi-Cal and went on Medicare. Now it's under Aetna. It used to be something completely different. So I think it's probably one of those Aetna C-SNAPs or something that you were talking about.
Yeah, and folks who have Medicare and Medi-Cal, as far as Medicare Part D plans, their choices among the plans are limited. There are maybe 6 this year, 6 or 7 that contract with Medicare to provide prescription coverage for special needs programs, one of them being Medi-Cal.
Thank you for putting the slide up again. That's helpful.
And I put please don't hesitate to call me directly. I put my information in the chat, both my name and the fact that I'm a HICAP counselor, my phone number, and my email address. I'm happy to help anyone on an individual basis.
Patty acknowledged earlier in the meeting at the beginning that she received her booklet this week, Patty, on the changes and the enrollment. Wondering if others on this call did also receive your booklet in the mail. You could put it in the chat or just speak up.
I just got it yesterday, so maybe it's,
Yeah. Okay.
maybe
All
I'm
right.
the vanguard.
Yeah. Well, that's a good point. Then just keep your eyes out for in your mail.
I got mine a few weeks ago, and in the back of the Medicare and You 2023 book, all the Medicare Advantage plans are listed, as well as all of the Medicare Part D prescription plans are all listed in a table in the back of the book. So it can be a very useful tool to sort out sort of where you want to go with your healthcare coverage for 2023. But remember, it's critically important to remember that we're in the window October 15th through December 7th, where you can change your Part D plan and you can change your Medicare Senior Advantage plan. You can go from Medicare, Medicare Advantage to original Medicare, from original Medicare to Medicare Advantage plan. And then at the beginning of the year, from January 1st through March 31st, there's another open enrollment period just for Medicare Advantage plans. So for example, if you decided that you wanted to sign up for Medicare Advantage Plan A, and you do that, it becomes it's in effect January 1st, and you try to get some appointments, or you do work with them and you decide at the end of January that it's not working for you, you have until March 31st to change to another Medicare Advantage plan. So that, I think that's been in place for 2 years now. So they extended the enrollment period for Medicare Advantage plans. It's a good option for people.
Well, Diana, thank you so much. It's so comprehensive, this information. And to me, it's almost like, it seems like this is more complicated sometimes than working with a mortgage broker or a landlord. It's just, it's so complex. So how important that we have HICAP around to be able to use as a resource for helping us make decisions.
Well, it's our pleasure to help, and I really encourage people to take a look, because things really do change. And just for an example, I worked with a woman at the Redwoods in Mill Valley, and she had a Part D plan and was just, not really looking at it on a yearly basis, and time went by, and her son actually suggested that she contact HICAP. She did, and it was before the pandemic, and I went down to help her, and we were able to save her $5,000 for the following year. So it's not insignificant. Sometimes the plan that you're in is exactly the right place that you should be, but it's good to have that assurance too. Yeah. So Patty.
I know I went to a HICAP group thing when I was first getting onto Medicare, and then subsequently have gone to individuals to reevaluate my D and figure all that out. And it was wonderful. The people are so knowledgeable and helpful. And I mean, there's no downside to going to get HICAP help. But I wondered about one of the takeaways that I got at that original group meeting was about Plan F. And you haven't addressed about trying to switch between plans.
Okay, so what Patty's talking about the supplemental / Medigap plans, and there's sort of this alphabet soup of Medigap plans from A through something or another. And what happened, I think maybe 2 years ago, is that the plan is, okay, so let me back up a little bit. what we typically advise people to do is to get as much coverage through a Medigap supplemental plan as possible. And now the most comprehensive plan is a Plan G. People who had a Plan F, say before 2 years ago, can stay with that Plan F. And the difference is that the Plan F paid for the Part B deductible. And the law changed, and moving forwards from 2020, I think, none of the plans will pay for the Part B deductible. It's a matter of $200 odd, but if you signed up for a Medicare supplemental plan before 2020, keep your Part F plan. If you didn't, then Part G, Plan G is the most comprehensive one now. And you can change your supplemental plan. You can go down in coverage, but you can't go up in coverage. And you can change it on your birthday and 60 days thereafter. So it's not really covered in this session, but a good thing for people to know who have original Medicare. So make sure in your mind that you distinguish between original Medicare and a Medicare Advantage plan.
Let's hope they don't get to letter Z sometime in the future. We got enough letters going now.
Way enough letters.
Yeah.
Way enough letters.
Anybody on the call have any questions related, or maybe just want to share your experience too?
Yeah, we'd really love to hear from you. We have a few minutes left, and I'd love to hear from those of you that are on the call. What kinds of experience have you had enrolling, and what issues have you had? It's helpful to me as a HICAP counselor so I can address them for other people.
This is Janice.
Hi.
So, hi. In fact, I do have an appointment with a counselor in November. Actually, I'm covered by, I'm a federal retiree,
Right.
and I'm still confused as to whether I'm doing the best financially by joining Medicare, as well as, I have two, so I have two premiums that I'm paying, so.
So you're paying your Medicare premium, plus you're paying for your employer retiree plan, is that correct?
Right, but fortunately, I'm with Kaiser, and they do have one of the Kaiser, I guess I did find out that one of the Kaiser plans, I do have, they will pay the Part B premiums. So I do.
So your retiree health plan will pay the Part B premium, is that correct?
Yeah, through Kaiser would be giving me a reimbursement, essentially.
Yeah.
Right.
Yeah, because
unfortunately, I did find out about that after a few years after I signed up for Medicare. So
yeah, and so that gets complicated.
Right. So I thought I'd just better review all this again with a counselor, since I just sort of found everything by myself. I said, am I doing the best that I can?
Absolutely, and you want to keep your, whatever makes sense of your employer retiree health benefits you want to keep, and you want to also dovetail those with the Medicare benefits so that you get the most comprehensive care that you can get, and at the least expense.
Okay.
Yeah,
yeah,
so
I'm trying to find out.
Yeah, so I'm very.
I really appreciate finding out about HICAP, just about maybe 2 years ago. I guess during the pandemic, I think I joined one of these teleconferences. Yeah.
I'm really glad that you did, and I'm glad that you have an appointment with a counselor and who can, address the details of your situation.
Right. Yeah.
And
so-
Janice, just a bit of a heads up. You can always ask the counselor to get another representative of the employer group health plan on the line and work together with them. And so that you really know what's going on. I often do that. I can get Social Security on the line, or I can get Medicare on the line and work with an individual client so that we really know what's going on, because sometimes we don't. I had a client who saw, I think, an ad on television. She was a retired teacher, and she decided that she was going to looked really good, and so she was going to let go of her retiree benefits, and she did, and it turned out not to be a good thing. And it's difficult, but we can get people back into their employer retiree benefit plans, but it's better not to have to do that. So
Right.
being careful makes a lot of sense when you've got different things going on.
Oh, well, thank you, Diana, for that. So I should maybe request at the beginning of my appointment.
Yes, and have the number ready. And also, if there's somebody that you've been talking to already, make sure that you know who they are, and because that helps too. If you've already spoken with someone, then they can, they know what's going on with you, and they know the questions that you need answered, and that can help the HICAP counselor too.
Who is this other person that you're referring
So
to?
what I'm talking about is HR where your retiree benefits are.
Oh, I see.
Yeah.
I thought it was another HICAP counselor.
No, this would be someone internal to your specific situation.
Okay, so it would I don't think that's going to happen with a
Okay, all right.
federal employee health benefits plan.
Well, I've done it before and gotten them on the phone.
Really?
So that we can be clear. People's situations are so different, and depending on how long they worked or what job they had, or a variety of different factors. So knowing as much about that as possible is very helpful for the HICAP counselor.
Okay, yeah. So all right, I'll see if I can reach out to someone. Thank you for this.
Thank you. We have two Gails on the call.
Mhm.
Anyone else? Hey, Gail, how are you? Any questions I can answer for you this morning?
I don't know how to reach you. I don't know how to.
We can hear you.
You can?
Yeah.
Oh, wonderful. Well, I just wanted to put in a plug for Kaiser, who has been very good for my family. And I hesitate to say this out loud and spread it, but they have an MFA account.
Yes.
Which a friend at church told me about, and I thought I would not qualify.
Mm-hmm.
Did, because the level of poverty in Marin is so high.
So what Gail's talking about is a medical financial assistance program that Kaiser has. And if people, and it's very helpful for people who don't qualify for Medi-Cal or for any of the Medicare savings programs, and will pay your copays and won't pay your premium, but will pay your copays and things like that. Tremendously helpful. It is, you can apply online. And it is valid for a year, and then you have to reapply after a year. But it's enormously helpful. Kaiser Permanente Hospital and Health Plan are nonprofit, and they have to provide services like this. And Gail, you bring up a really good point, because there are so many people who qualify for, say, an MFA program or a Medicare savings program, or even for Medi-Cal. and they don't apply. And one of the really key things for this year is that the asset limit for Medi-Cal has gone up from $2,000 to $130,000. So there are many more people who can qualify for Medi-Cal and receive those benefits and combine their Medicare with Medi-Cal and really get more comprehensive healthcare coverage. I really, we can help with that too. And I really encourage everyone to look into those things. Gail, I'm so glad that you mentioned that, and I apologize that I forgot to mention it.
Diana, I think we should tell people what MFA stands for, Medical Financial Assistance Program.
Yes.
MFA, because we've been throwing around initials and
Yeah.
they often refer to different things.
I think I mentioned it, but it's always good to mention it 14 times.
Thank you.
We have another Gail on the phone. Gail, do you have any questions? We have a few minutes left.
No,
Okay.
I actually need to leave, so.
Okay, thank you for
Thanks
coming.
for joining.
Thank you.
Thank you.
Diana, is MFA just a Kaiser thing?
Yes, and that's a really good question, Patty, because I know of it because I worked for Kaiser for a long time. And maybe, I don't know that United Healthcare or other Medicare Advantage plans have such a plan, but it certainly is worth asking.
It's been very helpful. It will keep me out of the poorhouse longer.
Yes, that's exactly right. I don't see any more questions, and I do want to give Patty a moment to let us know again about next month's forum. And then if we don't have any more questions, we're going to end the session for today.
Thank you, Diana. So next month on November 16th, again at 10:30, the forum topic will be Dying to Know, Navigating Mortality. So this has to do with, all right, so now you've died, what then? Are you going to have a composting? Are you going to have a traditional burial? Are you going to have your ashes scattered at sea? What are your plans? How do you discuss your plans so that your survivors know what you would like? And we're having a very experienced speaker for this. Jim Van Buskirk hosts death cafes, and that's an opportunity for people to come together and talk about all aspects of dying. And I hope that everybody will join us for that. It's people are reticent to talk about it, but it's for every single one of us. So I hope everybody will come next month. Thanks.
Thank you. Thank you, everyone, for coming this morning. And please don't hesitate to call if you have any questions or need any help with anything related to Medicare. Thank you.
Diana, again, thank you so much for sharing all this that you know. And we hope that those of you on the call will reach out.
Lots of information and presented very clearly. Thank you.
And those of you watching this recording. All right.